Hello and welcome to this short presentation about implant dentistry and training pathways. This presentation is designed for the implants curious dentist who has little to no experience yet in implant dentistry, who's overwhelmed with all the different courses and pathways available. So hopefully by the end of this you should have a bit more understanding of the discipline as a whole and a bit more direction in your search, depending on what level you wish to practice at. So I'm going to break this down into the following categories. First, what is an implant dentist or implantologist? What skills and training does an implant dentist have? How does one become an implant dentist or implantologist, or is there such a thing at all? How do you then assess case complexity and handle only the cases that you know that you can manage? And where should you go to for help? Who should you speak to, and where are the training institutions that you need to go to learn implants dentistry? So in terms of the definition of an implants dentist, it's a dental practitioner who provides dental implants and dental implant supported restorations. So that means that technically, or in theory, an implants dentist does all of that. So it does everything from the planning to the implementation to the delivery to the looking after the patient afterwards. Just for clarity, the two terms that are used are implants dentist and implantologist. Now in the UK in particular, the term implantologist is not a favoured term because it correlates it with terms like endodontist and prosthodontist and periodontist, which denotes specialities, whereas implants dentistry in the UK is not a specific speciality. Therefore, the term implants dentist, which could be anybody who has any level of training to provide dental implants, is a preferred term. What is the implants dentist? Obviously, they have to be a good dentist, so you have to be dedicated to your profession, interested in your profession, and have a broad range of skills. You need to be good at looking after your patients. You have to have empathy for your patients and a genuine understanding of your patients, knowing what their needs and wants are and providing solutions to fit their requirements. Good communication in implant dentistry is absolutely critical, because what you do in implants dentistry is invasive and technically irreversible. Now, yes, you can take out an implant, but that in itself is an invasive procedure. So unless you can communicate the broad aspects of what you're providing to your patient and tell them what they're getting, and know that you are not exactly copying nature, you're trying to emulate nature, explain to them the limitations of what you're going to be providing to them. Unless you know how to do that, or you have a system that enables you to do that, then you need to upskill in that area before you actually start providing dental implants. Your surgical skills need to be good. You have, ideally with some surgical background, you need to really understand periodontology, because that is critical in the understanding of the biology and the soft tissue and the bone in relation to a dental implant. And prosthodontics as well as restorative dentistry are absolutely critical as well. So unless you are clear on your prosthodontics and restorative dentistry, you really ideally need to either only do the surgery and working as part of a team, or if you're going to be a full-blown implants dentist, you need to know your implants, your prosthodontics and restorative dentistry. So as a more comprehensive definition, it's the field of dentistry dealing with the diagnosis, planning, surgical placement, prosthetic reconstruction, and maintenance of dental implants. So it's the field that combines all of those things together. It's important to emphasize the guidance standards provided by the General Dental Council in the UK, showing that, or explaining that, you should only really deliver treatment that you are trained to do, working within your competence, learning, training, continuing to learn. So all of these things are very, very important. So to be an implants dentist or any dentist of any area of expertise requires that you should work within your field of ability. So the most useful document to read in terms of training in implant dentistry is Training Standards for Implant Dentistry, which was originally produced by the FGDP UK, which has metamorphosed into CG Dent. A link will be provided alongside this presentation. It's a very important document. It really outlines what standard implant placement is, what complex implant placement is, what sort of training somebody should have. It doesn't quite define the exact number of cases you should do. It doesn't quite define the institutions you should go to, but it provides you with a broad outline of what would be expected of somebody claiming to practice implants dentistry, whether at a basic or at an advanced level. So it's a very important document to read. Our indemnity bodies also play a role in defining what we can and cannot do in dentistry as a whole. In order to qualify for certain levels of practice, we have to demonstrate that to our indemnity bodies that we are competent at those particular procedures. We must ensure that we are at the correct level of indemnity before we perform those procedures. This is often where we get stuck in our early careers because the premiums for dentists practicing implant dentistry are higher than for routine dentistry. The cost benefit of embarking on implants training then needs to be considered by the dentist. Effectively, is it worth it? The answer is usually yes, but each individual dentist can use this measurement to decide if implant dentistry is the way they want to go. So what do I need to know to become a dental implants provider or implants dentist? Firstly, a comprehensive understanding of medicine in implant dentistry is critical. As we're performing surgery with positive and potentially negative outcomes, understanding our patients' medical conditions, what medications they're taking, and how this can affect outcomes in both the long and short terms is absolutely crucial. We also need to understand our patients' needs and desires. These things being different, so what a patient needs may be very different from what a patient actually wants, and we need to understand both and try and bring the two together. For some patients, for example, removable implant-supported appliances, or even no implants at all, are better than complex, difficult to clean and maintain fixed appliances. So as implants providers, we need to have an understanding of what will be best for those patients at that stage in their life and in the future. Also, as implants providers, we need to have our basic surgical skills, such as raising flaps, cutting and drilling bone, understanding flap design, suturing, knowledge of wound healing. We have to have a full understanding of how that is going to heal. Our periodontal knowledge is critical in understanding the bone and soft tissue biology, the microbiology of the implant environment, and we would need to know various regenerative and augmentative procedures, such as bone and soft tissue management and grafting. When understood from a periodontological perspective, the implants dentist is usually more detailed and more accurate in their implementation. Prosthodontics, although the third in this list, is actually the core of implants dentistry. The surgical part is actually a pre-prosthetic stage in the provision of a dental prosthesis. So without the full understanding of the prosthetic outcome and planning it appropriately, the treatment will be unsuccessful or suboptimal. And there are bodies now like the CG Dent that are beginning to create certifications in various areas of dentistry, such as this one, the Certified Practitioner in Endodontics. You can see implant dentistry here shaded out because they haven't quite implemented the protocols yet for it, but this is basically what the future holds in terms of, rather than being on the General Dental Council's specialist list, you may achieve this certification The ADI also provides or will be following certain pathways as well, providing certifications and fellowships in implant dentistry. So again, when we are planning our careers, we need to look towards these things and see what level we need to achieve and what we will need to submit in order to achieve those levels. So this slide shows what we think the requirements of a good implants training program would cover. So all aspects of implant dentistry, including failures. So even though a lot of courses focus on how to place and restore implants, it's also very important to understand how to deal with failures, how to communicate those failures to the patients, how to fix those failures, how to manage them. Usually a good course should require a good amount of reading of the latest research, obviously all the basics as well. Essay requirements would be very useful depending on what level of what standard of training that you wish to achieve, whether it's just a certificate course all the way up to master's degrees or fellowships. You need to know, you need to decide whether you're going to enjoy doing essays. Every single training program should have hands-on instruction on plastic jaws or animal jaws. And then the crux of it really is hands-on placement. So you should be able to observe the tutor showing you how to actually place, live placement. And then ideally you should be able to place implants yourself under the supervision of tutors with a step-by-step approach, looking at every step, getting a feel for everything you're doing, developing those surgical skills gradually under supervision before you go out and do them on patients. As part of a training course, you need to know how to assess your cases and how to present them. Not just for the sake of presenting them to an examiner, but also for the sake of communicating what you're doing with patients. Most good training programs provide somewhere between 10 and 20 implant placements of varying levels of complexity. And ideally, again, going back to the idea of accreditation, so something that fulfills requirements set by the GDC and CG Dent in the UK. So for those who are interested in the courses but want to decipher the complex array of different options, this slide should help to illuminate. Courses can start from free introductory days all the way up to MScs, diplomas and fellowships. The time commitment and costs are displayed, and the final column shows you what sort of level you can achieve with each type of course. Obviously, those who are very dedicated to implants dentistry want to make that their main area of expertise, would go all the way down to doing postgraduate diplomas and fellowships and master's degrees. But a general dental practitioner who wants to include implants dentistry in their practice, in their daily practice, may be comfortable stopping at a postgraduate certificate such as this one, a level 7 qualification, for example, an EduCal level 7 qualification, or even just a structured certificate. And then ultimately, in terms of complexity of implants cases, how do you actually assess that and decide what level you're going to work at? There are various tools that help with this. This is the SAC assessment tool. You'll find this online and explains what the difference between a straightforward and an advanced and a complex case is. So SAC, straightforward, advanced, complex. Again, cases have overlap, so what may appear to be a simple case, for example, the provision of a lower molar implant and lower 6th position, may include GBR, guided bone regeneration. So knowledge of both is important. There may be thin mucosa requiring the addition of keratinized tissue. So does that make it advanced or complex? Again, so these assessment tools help you make those decisions. So if you look at this case here, for example, it's talking about an edentulous maxilla, where you need to decide what the patient's expectations are, the medical status, periodontal status, oral hygiene, smoking, etc., etc., the anatomical risks, are any additional procedures required, etc., etc. So that then helps to give you an idea of the complexity. This is sort of thing that you'd like to be able to use once you've done your basic training and then want to decide, is this type of case the sort of case that I should be handling at this stage, or should I leave it for others to handle? Ultimately, what you're asking yourself when you're assessing your cases is, do I have suitable training? Have I provided the patient with all of the options? Am I following best practice? And if not, why? So sometimes you have to diverge from best practice, but you have to be able to explain why you're doing this. Can I handle this situation if something goes wrong? This is a critical part of your decision making. So let's say you've reached a certain level of training and you want to attempt something that appears a little bit more complex or feels a bit more complex according to your assessment. Can you handle it? Can you fix it if something goes wrong? And that again is very, very important for you to understand. Every single person is different. So two people can have done the same amount of training, but one can be more confident or have more background skills and knowledge in order to fix problems as they come along. Ultimately, also, are you fully indemnified for that procedure? So these are things that we use the tools that we use to make our decisions. Working as part of a team is an excellent way of learning implants dentistry with minimal stress. So with that, you are able to work with a prosthodontist, periodontist, implant surgeon, oral surgeon, especially in your phases of training. Your support team needs to contain a hygienist, good nurses, a good patient coordinator or manager, and good management of the practice. So it's very important when you are starting out on your journey to make sure that the practice that you're working at can provide you with the support you need, the senior clinicians who can help you, and the support team who will look after the patients with you. So you'll be asking yourself the question, who should I go to for training and advice? Who are the people that I need to go to? Where should I be learning, and who should be supported? So looking at this slide, who are the bodies that govern or help in terms of implant dentistry standards and training? For example, we have now the College of General Dentistry. This generally now applies the national training standards. It governs the document training standards in implant dentistry. You can rely on going to the College of General Dentistry for independent evidence-based training or guidance, but it doesn't recommend individual courses or providers. So it sets the standards, and then it's up to us as the dentists to decide where we're going to obtain that training. There are professional implant organisations such as the ADI, ourselves, the BSID, ITI, BED, etc., in the UK. These organisations will help you, guide you, and provide you with various different courses. Universities, obviously, if you go there, you're going to get certificates, diplomas, MScs, and the previous slide that shows what sort of level of cost and time commitment is involved. You should rely on experienced mentors and trusted colleagues, people who can provide you with some guidance and their own personal experience in order for you to get honest insight into different course qualities. Also for mentoring, so it's very important to not only do your courses, but to have mentors who can then guide you through everything from basic to complex cases. Previous course delegates, people who've done courses before, ask them, find out what level of learning they achieved, what their feedback is, what they would have liked to have that maybe wasn't available, what they had a lot of that they were happy with. Look at independent reviews and
probably the least reliable thing is, unfortunately, course websites and online advertising. So it's very, very important when you do your Google searches or find something on Facebook or Instagram, that you actually look into the quality of those courses, who's teaching them, and if anybody you know has done those courses, and what sort of level of accreditation what level of accreditation you're going to achieve, compared to the benchmarks provided by, say, the CG Dent and professional organisations like the ADI. And if you'd like some further information, please write to us at info@bsid-uk.com, or go to our website, bsid-uk.com, and we do provide ourselves a foundation certificate in implant dentistry. So this is a great foundation certificate for beginners, people who want to get some hands-on training. We provide a 3-day course with practical training, along with a live surgery training in Cairo in Egypt, in case you might be interested. Thank you for listening to this presentation, and I hope to hear from you soon.